about the healthcare landscape post-election. I'm really going to focus a lot on sort of health reform and where we go moving forward and what health reform means for Arizona in terms of both opportunities and next steps in terms of policy decisions for our state. St. Luke's Health Initiatives doesn't take any position in terms of health reform. We didn't endorse the law, we didn't oppose the law, but we see it as law of the land and an opportunity to move Arizona forward in a lot of the issues that we care about. So when I think about health reform, I really think of three different sort of areas in which the law speaks to. The first has to do with issues related to access to care and health coverage. And so that can mean everything from whether we have people have health insurance or not, to whether it's affordable, but also to issues like whether we have an adequate workforce to actually take care of people. There are also areas in the law that speak to issues of quality, whether people are getting their care at the right time, at the right place, in the right way, and that has significant implications in terms of the overall quality of our healthcare system. And the final set of provisions in the law really speak to whether healthcare is affordable, whether people can afford to get healthcare coverage, and also whether we're bending the cost curve to make sure that the rate of inflation for healthcare doesn't continue to increase and outpace inflation. So I'm going to talk a little bit about recent events and where we are in terms of implementation of provisions of the Affordable Care Act and what this means for our state. So I'm going to back up to the month of June, when you will remember the Supreme Court rendered its decision on the Affordable Care Act. And as you will remember, they largely upheld the ACA, including the individual mandate, which some court pundits thought might actually be overturned. But they did actually give states, much to the surprise of many court observers, more flexibility to choose whether or not they wanted to expand their Medicaid programs. So under the Affordable Care Act, there is the goal of essentially making sure that most Americans have access to health coverage. And indeed, as the law was originally written, there were estimates that about 94% of all Americans would have coverage due to the Affordable Care Act. The court decision basically said that one of the ways in which the law looked to expand coverage, which is expansion of Medicaid programs, was really a state option. So states could not be compelled to expand their Medicaid programs. They had a choice on whether they wanted to expand Medicaid or not. And the court decided that essentially states could choose whether or not they want to expand Medicaid up to 133% of the federal poverty level. And if they chose not to expand it, they would not lose other federal funding for Medicaid in the process. So they really have a true choice to make. The Affordable Care Act in general really looks at three different ways of expanding health care coverage. One is through this Medicaid expansion, and indeed about half of all of the expansion across the country is estimated to be attributed to this Medicaid expansion if it were to be fully expanded. The other two ways would be through the implementation of a health insurance exchange, which I'll talk about in a little bit, and also through strengthening of private health coverage. So sort of a three-pronged approach to strengthening health care coverage, but one of the three areas now is essentially a state option. So Arizona has some important decisions ahead as it thinks about implementation of the Affordable Care Act. The first question will be, will Arizona allow more people to be covered under its Medicaid program? Currently, Arizona has eligibility for Medicaid set at pretty much 100% of the federal poverty level. For some populations, such as kids, it's actually higher than that. But generally it's at 100% of the federal poverty level. And as I referred to before, under federal law, under the Affordable Care Act, we will have the option to expand up to 133% of the federal poverty level. A second really important decision for Arizona moving forward is, will Arizona implement its own health insurance exchange, and what will it look like? And I'll talk more to that topic in a moment. The third big issue is, will Arizona take advantage of opportunities to improve its healthcare system? As I alluded to before, the Affordable Care Act not only contains provisions related to access to care and healthcare coverage, it also provides opportunities to improve the quality of our healthcare system. And so the question is, will Arizona take advantage of those opportunities, and to what degree? And the final important issue that Arizona has to make moving forward is, will we have an adequate and well-trained workforce that is prepared to address increased demand for healthcare and changes in how healthcare is delivered? So again, the Affordable Care Act is looking to expand coverage. If we know that if more people have coverage, there's greater demand for healthcare, which suggests that there'll be an increased demand for the healthcare workforce. And it's also looking to sort of shift how healthcare is delivered. So will we have a workforce that is essentially prepared to adjust to those changed demands? So let me delve a little bit into each of these issues in greater detail. So the first question again is, will Arizona expand its Medicaid program? Again, expansion can occur up to 133% of the federal poverty level, and that would be beginning in 2014. And it's estimated that about 300,000 Arizonans could benefit from that expansion. They would be eligible if we went up to 133% of the federal poverty level. One of the reasons this is a big deal for Arizona is not only because health coverage is a big issue and concern for our state. We have about 1 in 5 Arizonans without health insurance. But it's also a big deal because in over the recent years, we've lost coverage for many people under our state's Medicaid program. In Arizona, as you know, Medicaid is called Access. So over the past year, for example, we have put what's called a freeze on a certain portion of our Medicaid program. It's the portion that provides coverage to folks who are adults who do not have children living at home. It's called the childless adult population. And the freeze basically means that if you can't come onto the program, but also if you've lost coverage recently, you can't come back on and renew your coverage. And we know that on Medicaid, people routinely come on and off coverage if there are changes, for example, in their income. So because of this freeze, in just 1 year alone, we've lost about 130,000 people who have coverage on the Medicaid program through this childless adult population. They've lost coverage. And that in turn is putting pressures on our healthcare system as a whole. So, I was talking to Jerry before we started our presentation, but we've seen very large increases, for example, in uncompensated care at a variety of safety net hospitals and other providers in the state. As people basically become uninsured, they still seek healthcare services. Those healthcare services are not always paid for. And essentially that results in basically increased stresses on our healthcare system. Sometimes that means changes in policies in terms of who can be cared for or not be cared for. But it also can lead to cost shifting to all of us with health insurance, as providers essentially have to try to meet their bottom line. So it's a big deal for Arizona because we've basically lost coverage for a lot of folks in recent years. And just as a reminder, the population that essentially was affected by this recent freeze is the population that voters voted on to have coverage back in the year 2000. So there was a voter initiative called Proposition 204 in the year 2000 that basically guaranteed coverage for this population. This is the very same population that's been affected by the recent freeze. So another issue that factors into whether Arizona will expand Medicaid or not is essentially the match that is provided by the federal government through the health reform law that essentially will entice many states to get on board with expanding their Medicaid programs. Depending on the population you look at and the timing, roughly 90 cents on the dollar will be paid for by the federal government if we choose to expand our Medicaid program. To give you some context, currently today for our existing population, about 66 cents on the dollar is paid by the federal government. So we'd get a much more generous match from the federal government for that expansion population, for those that we would add to Medicaid. And there are lots of reasons why that might be enticing to the state. Not only is it additional dollars to pay for that population and for their health care, but their economic benefits for increased federal dollars coming to the state. Given all of those positive reasons why Arizona might expand its Medicaid program, there are lots of unknowns at the current time. One is what the governor might want to suggest or propose in terms of Medicaid expansion. When the Supreme Court made its ruling on the Affordable Care Act and essentially offered states this flexibility on whether they wanted to expand their Medicaid programs or not, the governor, to the surprise of many pundits, essentially did not come out and say, no, I don't want to expand, like the governor of Texas did. Instead, she took a more thoughtful approach, much to her credit, and said, let me look at all the factors and take some time to make this decision. So in the meantime, she's been engaging stakeholders and getting a lot of feedback. So we don't know at this point in time what she is likely to propose. That said, there have been some hints, essentially, from the governor's office that one of the things that she's considering is to expand coverage only up to 100% of the federal poverty level, which would essentially restore coverage to that Proposition 204 population, the folks who've lost coverage in recent years. So that there are some hints that may be what she is looking at. But there are, again, some unknowns associated with that. So one of the unknowns is whether the federal government would allow Arizona to draw down that enhanced match that I talked about, that 90 cents on the dollar, to be able to provide coverage to those folks, or if we only went to 100% of the federal poverty level as opposed to going up to 133% of the federal poverty level. So there are some unknowns at the current time, and we'll be learning more about what she intends moving forward. Another critical question for the state will be whether or not we want to run our own health insurance exchange. And to remind you, a health insurance exchange is essentially this vision that there'll be these online marketplaces, and people sort of often describe them as sort of like Travelocity experiences, although I'm often reminded that it'll be far more complicated than that. But where people can compare private health insurance products and essentially make better choices about their health insurance decisions, and also be offered a wider array of choices. Health insurance exchanges, as they are envisioned under the Affordable Care Act, will benefit both individuals and small businesses. And it's a big deal for Arizona because it's estimated that about 1.2 million Arizonans could receive their coverage through a health insurance exchange. One of the reasons so many people are envisioned to get their coverage through the exchange is the exclusive mechanism by which people can get tax credits. And people will qualify for tax credits through the exchange if they earn between 100% and 400% of the federal poverty level. So it's not just low-income people. Definitely, well into the middle class, they'll be qualifying for health insurance tax credits through the exchange. And right now, there are advocacy efforts both for and against the state-run exchange. So this is an area of great contention at the moment. In addition to the decision of whether Arizona wants to run its own exchange, and if Arizona doesn't run an exchange will be run for us by the federal government, and all of this will begin in 2014. There are other issues related to the health insurance exchange that are very important for Arizona to think about as it moves forward. One issue is whether people will even know about the health insurance exchange. I don't know about you, but I don't hear people talking about this much, even though it's on the near horizon. Another critical issue is how will people receive needed assistance. There are some indications that Arizona may be putting aside far fewer dollars for assistance for people to enroll in coverage in the exchange than other states. So, for example, I've seen some preliminary estimates that suggest Arizona might put as little as $500,000 into providing sort of one-on-one assistance to folks, while states such as Arkansas are putting aside $17 million. Big difference, right? And I often talk about, if you think about when Medicare Part D came up, when people are offered a new benefit, there's often a lot of confusion around that. So, you need to sort of provide people with that one-on-one assistance for them to truly understand what their options are and to be able to evaluate their choices. Another critical question will be how consumer-friendly will the exchange be? Will it be easy to navigate? Will people understand their choices? And then finally, I think another big issue is how much churning will occur on the exchange. So right now we know people come on and off of programs such as Access, our Medicaid program, all the time. I've seen some recent studies that suggest that churning on the exchange will make that pale in comparison. So what will happen on the exchange is people may come onto the exchange and qualify for Medicaid, or they may qualify for a subsidy through a private health insurance plan, but they may also not qualify anymore for either of those things, depending on their work experience and in terms of whether they're offered affordable health coverage through their employer and whether their income changes. That, coupled with the fact that you'll have in the same family some people qualifying for Medicaid, like kids might qualify for Medicaid and adults might qualify for a private health plan, how we manage all of those differences and keep people on coverage, keep them in the same network of providers, ensure that consistency of care is going to be a big deal. So let me go through some of the key dates ahead. As I mentioned, right now the governor's office has been engaging stakeholders, and on the very near horizon, a week from today, the governor actually has to submit her intent related to whether Arizona wants to run its own exchange or not. So 1 week from today, that decision will be submitted to the federal government. That said, if the governor chooses for Arizona to run its own health insurance exchange, we will actually have to pass legislation to make sure that the exchange is operational and that it's financially self-sustaining by 2015. So if the governor chooses to run the exchange in our state, she is expected to introduce legislation in January to do so. In January 2013, there are also two other critical decisions that will have to be made. One is whether Arizona will essentially have the infrastructure in place to run its own exchange. So if the governor chooses to run the exchange for our state, the state has to be certified by the federal government as having adequate infrastructure to run our own exchange. In 2013, in January, probably during the State of the State, the governor's also expected to announce her decision related to what she wants on Medicaid, whether she wants to not take advantage of the opportunities in the Affordable Care Act, whether she wants to reinstate coverage to 100% of the federal poverty level, or whether she wants to take advantage of the increased match and go up to 133% of the federal poverty level for Medicaid. Then in October 2013, open enrollment for the exchange begins. So that is just around the corner, right? And again, I keep saying, do many folks even know about the exchange? And this is right around the corner. So whether or not Arizona wants to run its own exchange or not, there will be an exchange. There will be an exchange. It'll either be the federal government running it for us or Arizona running the exchange. And that's right around the corner. And then finally, as I alluded to before, by January 2015, the exchange must be financially self-sustaining. So we have to basically figure out a way to raise the money, either through fees or taxes of some sort, to have an exchange that's financially self-sufficient. So I mentioned at the beginning of this PowerPoint presentation that I was going to be talking about the recent elections and where we are today. So let me talk a little bit about the political context of this and what it means for some of these decisions. First of all, as we know, just because of the presidential election, we believe that the Affordable Care Act is the law of the land and moving forward. You know, the Supreme Court already made its decision on that, and certainly it doesn't appear that there would be any way to overturn the Affordable Care Act during this administration. So we are truly looking at implementation at this point. And it really gets down to what will happen in Arizona as we think about implementation of the law. St. Luke's Health Initiatives a couple of weeks ago actually did polling on the Affordable Care Act and issues related to Medicaid expansion and the exchange, mostly focused on Medicaid expansion. And you know what we find is that voters in Arizona are split on the Affordable Care Act, just as they're split across the country. In fact, they were, when you looked at the numbers, they were dead evenly split on whether they support the Affordable Care Act or not. Not surprising. That said, you know, what we know is that people, when you look at the individual provisions of the law, people are very supportive of what's in the law. The exception really being the individual mandate. People do not like the individual mandate. Even though, you know, essentially half of voters do not like the Affordable Care Act, only a third of Arizonans want the ACA repealed. So a lot of folks basically in the electorate accept that it's the law of the land and basically want to move forward. And that said, that includes about 60% of the Republican voters in the state. And why that becomes a big issue is we do have a Republican-controlled legislature, so that is an important distinction. When we think about Medicaid expansion and some of the issues that our state is facing, though, when we talk to voters about what they care about and what they think, one of the things that's very interesting is that there's really strong bipartisan support for Medicaid and access. So both Democrats, Independents, and Republicans like our access program. They think it's a great program. And it's really important to think about that in terms of how we talk about some of these issues. In our poll, we asked voters essentially about their thoughts about whether Arizona should either keep things as they are currently, where we have a freeze on our existing Medicaid program, whether we should be restoring coverage to those who have lost it, going back up to 100% of the federal poverty level, or if we should take advantage of the opportunities under the Affordable Care Act to expand coverage to 133% of the federal poverty level. And what we found is that more than 60% of Arizonans want to either restore or expand Medicaid. So there really is strong support for that, and it's bipartisan support. We also found that there's strong bipartisan support for an exchange in general. So what does that mean in terms of what's likely to happen? So the recent elections essentially show us that the legislature has become somewhat more moderate, both in the composition of some of the Republicans who are in the legislature and also in the split between Republicans and Democrats. So for example, there's no longer a supermajority of Republicans, so there's more likely to be more compromise between Republicans and Democrats in the legislature moving forward. We also have some early suggestions that the business community appears to be supportive of both a state-run exchange and some type of Medicaid expansion, whether it's either restoration of Medicaid or full expansion of Medicaid. That said, there are some very vocal critics of Medicaid as well as a state-run exchange still in the legislature. We have some lawmakers who want to do away with the whole Medicaid program, let alone expand Medicaid right now. And the recent elections, if you paid attention to it, was it yesterday or Tuesday, Wednesday, I guess it was, of legislative leadership, suggests that some of the folks who were chosen as leaders are not very favorable to the idea of Medicaid expansion or restoration. So there's some uncertainty about what that means in terms of some of these proposals. We also know that through our polling that when I told you that about 60% of the electorate wants to do something with Medicaid, folks are basically split between those who want to restore Medicaid and those who want to go up to 133% of the federal poverty level. So there's unfortunately the potential of disagreements among those groups, which could further complicate any type of Medicaid, either restoration or expansion. So I've focused a lot on coverage and the opportunities under the Affordable Care Act and the critical decisions that Arizona has to make moving forward. But I can't underestimate the importance of the other things that are in the Affordable Care Act and what they mean for our state. And there's a lot of provisions in the Affordable Care Act that really are aimed at improving quality and lowering costs. And I think there are great opportunities among funders to really work with our state and look at these opportunities as ways to improving our healthcare system. And indeed, Arizona is already moving forward in a number of these areas and taking advantage of some of these opportunities. One of the opportunities has to do with coordination of care and integration of care. So for example, we already see our state moving forward in terms of things like integrating acute care and behavioral health care services in our state's Medicaid program for the seriously mentally ill in Maricopa County. There are lots more opportunities to provide community-based care and things like expanding the number of federally qualified health centers. There are opportunities to really focus on chronic disease management and focus more resources on those types of efforts. There are lots of provisions in the law that essentially are aimed at bolstering primary care that can be taken advantage of. There's considerable resources that are invested in prevention through the Affordable Care Act, public health trust fund that essentially sets aside dollars to do that. And there are new opportunities through demonstration projects and other efforts to incentivize value-based healthcare. Moving towards systems such as accountable care organizations where we're changing how people get paid to incentivize quality and outcomes and hopefully essentially bend the cost curve over the long term. Finally, I'm just going to end by saying that, talking a little bit about workforce. We know from states such as Massachusetts that when you expand coverage, you essentially drive up demand for health care, and that puts stress on the existing workforce. You end up needing more people to provide care. You also need oftentimes a different mix in terms of reforming healthcare, a different mix of providers. So, we're moving towards more team-based care and shifts in terms of who may be providing care, more focus on primary care providers as opposed to specialists, for example. Looking at alternatives in terms of teams where you might have, for example, nurse practitioners taking a greater responsibility for caring for people as opposed to doctors. Arizona right now has a shortage of healthcare professionals. So for example, our physician workforce is smaller than the national average. We rank about 33rd nationally in the number of physicians. So what we know is essentially as you provide more access to healthcare through health coverage, we are going to be driving up demand and further exacerbating some of these workforce shortages. So one of the things we also need to be paying attention to, both at a policy level and as funders, is how do we think about these issues of workforce? How do we make sure that we are creating an adequate pipeline of health workforce professionals, but also how do we make sure that they're trained in a way that they can respond to the changes in the delivery system as a whole. And those are some of the changes that are happening right now. I'm just going to end by saying something, some folks have heard me say this before, but after healthcare reform was passed, I had the privilege to going to Boston and hearing somebody by the name of Atul Gawande speak, who's sort of a guru in the healthcare world, a really great thinker. And he talked about healthcare reform and the way he thinks about it. And he said something that I thought was really interesting. He said, you know, no national law really can reform our healthcare system, if you really think about it. Reforming our healthcare system ultimately means experimentation and action at a local level. It's really going to require how do we basically put the pieces in place to make sure that we have a healthy population, people have access to healthcare, and that we're really experimenting with how to bend that cost curve. And so it really puts the onus on us as both funders and as a local community about what are we going to do with our healthcare system, how are we going to reform it and take advantage of the opportunities in this national law. So that's it. Thanks. Questions?